This is Taking Stock on Bloomberg. I'm Pimm Fox. All right, we're taking an ongoing look at medicine and money, the ideas and the innovations that transform the healthcare industry. Recently, I underwent a transnaval esophagoscopy. I'm glad I said it. It's a procedure that uses a new endoscope technology that gives doctors a less expensive, easier way to go inside your body. Sticking a tube up your nose might not sound like much fun.
We're using the skinnier one. It's basically 3 millimeters. It's like a piece of spaghetti. So it's very, very small. And I'll look and we'll see.
I don't think I've had a piece of spaghetti up my nose since I was in grade school, but let's try.
Okay.
But compared to other methods of checking for esophageal cancer, such as biopsies, an endoscope can be more convenient, less painful, and yield quicker results.
The remarkable thing here is that we're able to get the identical look that you would have otherwise had to do under sedation in about 3 minutes with you wide awake, not uncomfortable.
With rates of esophageal cancer on the rise, jumping from 5,500 cases in 1973 to more than 16,000 in 2010, according to the American Cancer Society, medical professionals predict demand for this procedure could grow.
It's almost nutty that this is not being embraced worldwide instantly, but it's probably going to take well-known people like you to say, look, I'm the age group, this is how I'm getting it done, and look how easy it is.
Now, for more on the benefits of the inside story of transnaval esophagoscopies, we're joined now by Dr. Jonathan Aviv. He's the clinical director, Voice and Swallowing Center, ENT Associates, and a clinical professor at Mount Sinai Medical Center. Dr. Aviv, good to have you with us. As I said, I don't see you in the white coat, so now I know it's you. You know, in doing this procedure, I did not know really the nature of esophageal cancer. What is happening with this type of cancer specifically?
It's remarkable what's happened. It is the fastest growing cancer, not only in the United States, but in Europe, the past 30 years. The incidence of esophageal cancer in 1975, this is cancer caused from too much acid, was 4 per million. That's 1975. In 2005, it was 24 per million, a 600% increase.
So why is this happening, do you think? Is it because of better detection, or is it because people are living a lifestyle that increases the possibility of getting this kind of cancer?
It really is the quote-unquote Western diet. Almost all bottled and canned foods have acid in them as a preservative. This started in the mid-70s, about the time we started to see the first increase in esophageal cancer. So many of the foods we eat today are ones that have a lot of acid.
Rich in acid.
Rich in acid.
And that's not good for the body.
Well, some people believe, and there's a lot of data that suggests this, that acid causes esophageal cancer.
All right, so if the doctor wants to check for this kind of potential cancer, what have been the traditional methodologies?
Typically, until about 10 years ago, what was done is you were knocked out. You were given a type of sedation called conscious sedation or intravenous sedation, and a scope, a fairly large scope, was placed in your mouth and slid down into your esophagus and stomach, and biopsies were performed.
So now there's new technology. I mean, what was the scope that you were using? What's that about?
The scope I was using is a Vision Sciences scope. It's 3 millimeters. It's about, you joked, it's about the size of a piece of spaghetti. It goes in the nose. And the reason we go through the nose, hence the term transnasal, is that the gag reflex is in the mouth. When you put a big scope in the mouth, you have to sedate someone because the gag reflex is so powerful. So we use the body's physiology and anatomy. We go through the nose, therefore we go behind the gag reflex. You weren't gagging at all.
No. So all right, so you use the new technology. Why wouldn't doctors and hospitals automatically adopt this? I mean, is it less expensive than the more traditional approach?
Well, it's far less expensive. For instance, the Vision Sciences system is about $27,000. The competing systems are about $85,000. We'll talk more in a minute about the overall impact on healthcare, but your question about why isn't everyone adopting this, really, while the technique was available in the mid to late 90s when I started using it, it wasn't until maybe 2-3 years ago that the scopes got very, very small. And really the most important thing, a single-use disposable sheath can be placed on it to prevent cross-contamination, meaning someone just had a procedure, you don't want the next person to get the bacteria that was assembled on the previous procedure.
And what about like reimbursement from the government? I mean, is it going to be less expensive for the government as well? Because we're all trying to contain healthcare costs.
Well, that is a terrific question, because the cost now for a sedated exam starts at about $1,000. This is about $300.
There it is. Thank you very much.